guys, welcome to Candid Conversations. Colleen, Amy Michelle, and this guy is Dr. Taylor. I know some of you probably can't recognize him because he's not in coveralls, tech gear, all
Don't
the fun
have a light
stuff.
on my head.
Right, yeah, but it is him, I promise you. So we have spent weeks, probably. We have a large farm here, we have multiple horses, and we did our fall teeth, our stragglers, because we had some new horses move in, and now we're to spring, we've got our spring teeth. But what we've decided to do is actually break this into segments because there's so much great information from it. Normally we'll just do a full conversation and break that into shorter segments for Facebook, but because there's so much great information with you, and you were kind enough to let us pick your
always
brain.
kind to ask questions, and
I
you
know.
just patiently answer the question, and it's
I tell
awesome.
people if I have an answer, I'll give it to you, and if not, I'll make one up.
Well,
They're good. They're
really good. We don't know if you're telling the truth or not, but you're a wealth of information,
Yes.
so we just appreciate you letting us, hijack the appointment and ask the questions and share with the people. And a lot of people, at least in our area, use you for their horses, and I know we're pretty excited to have you here at our farm.
Absolutely. Yeah.
It's
always a
pretty cool.
pleasure.
Well, thank you.
Yeah, definitely. So if you're not subscribed to our YouTube channel yet, please do that now, whether you're watching on Instagram, listening to our podcast on Facebook. Go to the YouTube channel. We'll put the link here for you. Remind me your website again.
It's www.tailormadeteeth.com.
TailorMadeTeeth.com to get more info on Dr. Bryan Taylor.
And I'll warn you, the pictures on that website are very old. So
Are they?
I had more hair.
Oh,
My
okay.
kids are about a quarter of the size they
More
are
hair,
now.
I'm so checking that out. We'll put the link to that too.
Not much more, but a little bit more.
Okay. Mark had more hair till we got married. I went whoop, took it right off. What are you going to do? So I have a question, and I made some notes as I started editing this the other day. So when you start that appointment, right, you're checking the horse before you even give the injection to sedate or to kind of knock them out a little bit. What are you checking for, and under what conditions would you say, yeah, we can't proceed?
Well, overall, you want to make sure that the horse is healthy enough
Sure.
to not only for the sedation that you're using for the procedure, but to actually just for the stress of the procedure. Most of the horses that I'm working on are a little anxious about it, some more so than others, but it's not a normal thing for them, and so they can be, it's a little stressful, for them, either between mildly and be major stressful for some of them, which the sedation helps with, but I want to make sure that they're going to be healthy enough for to use the speculum, to get a good exam done, and to use the sedation in a safe manner. So usually from the point that I'm pulling up and looking at a new horse, or even a horse that I've looked at before, you're evaluating their overall body condition, the way they're standing, the way they're breathing and acting. I've had some horses that I pulled up on the farm before I even got to work on, and you look at them and say, that horse is colicking, or something.
Wow.
You just pick up on their body language and that type of thing, and you're picking up on things ahead of time. Like, dentistry can wait. We're going to take care of these other things first. It's more common for me to have some horses that may be having some respiratory issues, some inflammatory airway disease. That would be one thing that we would probably hold off on if they're really pumping hard to try to breathe and they're having a hard time. You don't want to stress them out. And you don't want to give them a sedative in those situations that it's going to slow down the respiratory rate even more when they're already trying to work hard to breathe. So I've had some of those horses that we've kind of just held off, gotten them the appropriate therapy, or even just picked a different time of the year. Some horses, those types of things can be very seasonal. So we know if they're bad in the springtime, it may be better to do dentistry in the fall on a horse like that if they've got better times, that kind of thing. I've picked up on just listening to heart and lungs and all. It's not a thorough, big in-depth exam, but you want to make sure they've got a normal rhythm, that we're not dealing with any substantial murmurs or something that would once again be a concern for the sedative or stressing the horse out, and just make sure the horse is in good condition before you get started.
Gotcha. Because you are a trained, certified vet.
Yes, I'm a licensed vet.
Specializes.
I did 6 years of general large animal practice, the majority of which was equine. But we did cows and pigs and llamas and everything else too. But the interest in dentistry really started in vet school, particularly the equine dentistry. I had done small animal dentistry just as a tech and a helper prior to getting into vet school, but had never really done much in the way of equine dentistry until vet school. And getting started into that. It was just such a different approach and feel, and procedural, wise than the small animal dentistry. It just kind of sparked an interest and went from there.
Did you also do, I know you talked about, I know cows only have their bottom teeth, but pigs and other sheep and llamas and all that, did you work on their teeth too?
We did. The horses in particular got more regular dental care than I would say the other animals did. In particular because they're one of the few horses you're going to have a bit in the mouth, and certainly dental issues can be an issue, a problem for riding and that type of thing. We did do some occasional cattle dentistry. Usually it fell into circumstance where you had an infected tooth or something that was affecting the health of the cow. We rarely, we never got called out to do a routine dental exam on a cow or anything. The other species.
You're laughing because we used to own cows, and that's something I mean, well, can you do our cow?
Right. I get this question a lot. It would be one of those things, and I get the question a lot, do they need floating and that type of thing? And the answer is they would probably be more comfortable with some floating, but trying to float a cow is going to be a little bit of a problem.
Please let me film it if you ever do.
Yeah, I was going to
right.
say.
And if you do, it'll probably be here.
The other species, though, we had some other species that did require some occasional dental care. In particular, the llamas, they have canines or specialized teeth that are the fighting teeth on the males, and they get long, almost kind of tusk-like. So we would do some trimming on those from time to time, and then of course the pigs, can get tusks basically development, and we would, especially on the pet pigs and potbelly pigs, we would from time to time have to go in there and kind of trim and work on those teeth too, so that they didn't get too long.
Interesting.
Yeah, I was just curious when you had said you were in the dentistry work. I was like, well, there's stuff beyond horses. So
I got a colleague in Georgia that has become one of the kind of leading guys on rhinoceros dentistry. So, and I've watched him.
Are there a lot of rhinos in Georgia?
There is actually a rhino sanctuary somewhere in Georgia that they've got a kind of an area where they live and stuff. And I've listened to him give a couple of talks on rhinoceros dentistry, and what I've taken away from it is A, it's fascinating, and B, I don't ever want to do it.
Well, I couldn't imagine, they'd have to sedate him and everything else you have to do, but wow.
It's a lot more labor intensive than working on the horses.
Sure. Oh my gosh. Well, I would assume the typical stuff that you see is the hooks and the waves. What's a typical horse for you on an exam?
Well, and I'm going to go over a little bit of terminology here, because there's a lot of people use some of those terms interchangeably, and rightfully so. I understand a lot of times when you talk about things, you're describing what you're seeing, but technically it's not the right term for that. The most common thing that we see on horses, the thing that we do year to year for maintenance, is basically addressing sharp points in there. And those are sharp enamel points that form typically on the outside of the upper teeth and along the inside rim of the lower teeth. Now you can have them form anywhere on the horse's mouth, but those are the typical presentation where you'll see that. And that's a type of thing that if you get in there and do floating, which is just a term for removal of those sharp points, we usually use some type of grinding device. Previously, and some people still use a lot of hand floats. It can be done with hand floats, which are basically specialized files. I used motorized floats, which use a diamond bit grit, abrasive surface for the floating for what I do. But there's several different mechanisms to do it. But essentially what you're wanting to do is remove those sharp enamel points to try to help with the comfort of the horse. In some cases, if those enamel points get sharp enough, they can cause lacerations and abrasions on the cheeks and on the tongue. On horses that are done regularly, I usually don't see them too much, or if I do see them, they're usually mild. Horses that I see really bad ones on are usually ones that have not been done on a regular basis. It may have been 5-6 years since they've been done. Now, during that time, I think there's a little misconception that these points will get worse and worse and worse during that period. That's not really the case. They usually get sharp to a point, when intended. But
no.
They will get sharp to an extent.
Bye-bye.
Yeah. But then they don't get longer or sharper beyond that point. Now, some of these horses, depending on on the shape of their teeth, their age, the way their jaws put together, they will have more severe, sharper points than other horses. I've had some that just year to year have very mild points, and quite honestly, if you skipped a few years on them and you came back, they probably still have just very mild points. So others are much more critical to try to keep them on a very regular basis. I've got some that we have to do every 6 months because they just can't go a year.
Is it the way, like, their conformation in their mouth and the way they kind of grind?
Yes, all of that plays into it. It really, one of the bigger factors is the shape of the tooth itself, a sectional shape on it. And all these horses have got ridges, lateral ridges on the outside of their upper teeth that kind of go out and in, and everywhere there's a point where that tooth goes out and then comes back in is a place where a sharp enamel point will form. Most of their cheek teeth or chewing teeth will have 2 spots where you'll see a point form on there, and then they'll have a valley where it comes in on the rest of it. Now, if they have very pronounced ridges, they are very likely to have very pronounced sharp points too, and those potentially could be more of an impact on a horse that has those really pronounced ridges than ones that have a little smoother contour to the sides of their teeth. But the way their jaw is put together, the angulation of the occlusal surface in there, all of those things can play into how quickly and to what extent those points will form in their mouth.
What about a wave?
A wave is what we call a malocclusion. There's a whole class of abnormalities, if you will, in the mouth that we call malocclusions. And a malocclusion is just the way those teeth fit together.
Okay.
A wave is one of the more common ones that I'll see. And it essentially is where the crowns, the erupted crown of the tooth is longer in certain areas and shorter in certain areas. So when you look at a horse's mouth, very often it will look like a wave. You'll see it kind of go up and down. Now, a wave can be a single arc from the front to the back, where the middle of the upper teeth are kind of short and the middle of the lower teeth are long, or vice versa. I've seen the other opposite to take. And then a more common wave would be kind of more of a sigmoid wave, where it kind of goes up and down and back up again. It looks like a roller coaster, basically. Now, those can vary from very minor to, slight, where they're really insignificant to the horse at all, to ones that are very extreme. I've seen some that have been horrendous going in there. They take time to develop. No horse is born with a wave. And whether or not they develop waves in their life can be multifactorial as well. Sometimes as these baby teeth are coming in and they're losing permanent teeth, that can be where the wave sometimes gets set up because you have teeth that are maybe ahead of the other teeth, the opposite ones. In other cases, it may have to do with the density of the upper versus the lower teeth, or the way the horse chews. All of those factors may play a role in whether or not they develop waves. And a horse they might go 10 or 15 years without a wave at all, and then they get to a different stage in their life and you start to see a little one start to develop. And you have to kind of make a decision at that point whether you feel like it's significant to the way the horse is chewing and whether or not you need to make some corrective work in there. And when I say corrective work, typically that means using a float or some type of grinding device to shorten the crowns that are overlong in there, and in order to try to reestablish a little bit more of what's considered to be a normal occlusion going on in there.
Now, I know with Colleen's horse, who's older chief, he's to the point where his teeth have stopped erupting.
Right.
And so elaborate a little bit, if you will, on why you wouldn't do much there, because that's the situation.
Yes, and that's what's going on with her horse. These horses have their eruption cycle does not last their entire life. A horse, when they're probably by the time they're about 2 or 3 years old, they pretty much have all the tooth material they're ever going to have. But the majority of it is below the gum line. It's called reserve crown. If you take a radiograph, you can see they have these real long, what look like roots, but they're actually not roots. They're actually chewing crown. They're useful chewing crown on there that will slowly erupt up into their mouth as the occlusal surface wears away and they grind away at it. And the idea is that this slowly erupts, and the tooth ideally will stay about the same height through most of their life. But they only have a certain amount of that reserve crown. And horses, typically when they get up around 20, that eruption is going to slow down and stop at some point. And so usually horses, 20, early 20s is when you see it. I've seen it happen as early on some horses as late teens, actually, where the eruption stops. Now, at that point, you need to be a little bit more cautious about making major changes in their mouth, especially ones that involve reducing what we call the clinical crown, which is the crown that's above the gum line. because they are not getting any fresh crown coming in.
Gotcha.
The whole idea behind trying to correct a wave or a hook or any type of these overlong teeth in there is that if you reduce the overlong crown, you're allowing the short crown to catch up by erupting unimpeded for a period of time. But if it's not erupting, that's never going to take place.
Right.
So on an older horse, if you have a wave in there, and if you go in there and you reduce the long crown, you're going to potentially end up with a gap that might be permanent on that horse because the short tooth is not catching up with the little one.
And then
So
that would affect their chewing.
It affects their occlusion, it affects their chewing, how much they can chew on there. So I'm much more likely in an older horse where the eruption is either slowed or stopped to maybe leave a little bit of a wave or a little bit of irregularity in there if it means that the occlusion, the contact between the teeth is going to stay where it is.
Gotcha.
I don't want them to lose that contact.
Gotcha.
Now, if that wave or hook or overlong tooth is to the point where it's interfering with things, then you need to make a correction.
Sure.
But in my opinion, I think a lot of these horses, if they have kind of mild to medium-sized waves, they can get by with that fine. And that horse, especially in an older horse, they've learned that that's the way their mouth feels and works, and they've learned to compensate. And if you go in there and start trying to willy-nilly shorten teeth and all that, you're going to really change up the way their teeth fit together. And not only are they likely to be kind of sore afterwards on that, because you've changed the way the pressure is on their jaw and their teeth, they may not be able to function as well without that small wave as they could with just leaving it in place.
Gotcha.
So you have to make a decision on how significant that wave is on some of those older horses and how much of a correction, if you're just going to do a little bit or if you're going to try to all out, try to get it to the point where you've got a nice level bite. Now
as they get older, obviously the teeth wear away, but then do they go away? Do you have horses with no teeth?
Different things happen in different horses, and I think a lot of it has to do with genetics. A lot of it's going to have to do with the health of the root and the support structure on that tooth.
Okay.
If they've got good, healthy periodontal system that is holding that tooth in place, that tooth is likely to just keep wearing away until there's nothing there.
Right.
If at some point that periodontal support system starts to break down or degenerate, then that tooth can very often become loose, and a loose tooth is not real comfortable for these horses when they're trying to chew and wiggles.
And that's what happened with Ron.
Yes, yeah,
Okay.
you've got a situation, and it can happen at an early age too. I've got periodontal disease that can set in. Usually you don't see it in horses, say, under 10.
Okay.
But I've got periodontal disease that can set in at early stages of teens in some cases. And if there's something abnormal, I've seen it in younger horses as well. But it's very common to see at least some degree of periodontal disease in horses from like late teens on. Now, whether or not that's significant enough to end up losing a tooth or needing a tooth extraction just depends on the individual horse and what's going on.
Yeah.
We're very concerned at that age when they have periodontal disease setting in with stability of the tooth and then also overall comfort, whether or not that tooth is possibly painful because it's mobile or moving around, or just the fact that it's getting a lot of food caught around it may be painful and causing a lot of gingivitis or inflammation in the soft tissue.
Gotcha.
So in those cases, all of those things might be factors that you consider on whether or not you think you might need to go ahead and extract the tooth. I personally like to leave them in as long as they're functional and not painful and healthy.
Gotcha.
And if I start to see anything that's kind of messing up that little balance in there, then you have to start thinking about, all right, is it time to maybe extract this tooth, or
Right.
is this horse going to be better off without that tooth than with that one in place?
Right. Yeah. And do you always bring in somebody to do x-rays, or was that just because of that weird lump that he had?
With him, I just wanted to see what was going on underneath the gum line. And most veterinarians have a portable unit that they can shoot on site. I don't.
Yeah.
I just
Yeah.
financially,
Yeah.
Santa Claus hadn't brought me one yet. So
I will put it on.
And-
Put it on the
and-
list.
Sure.
Yeah.
the nice thing is that I've got a good support group of other vets around that do referrals and stuff. So if I have one I need to shoot radiographs on, I very often have got a vet that is either already going to that barn that can shoot them for me or meet me there, or if I've got one that I'm trying to evaluate for an extraction or something a little more serious, I'll bring them into, I've got several clinics that I work out of on a regular basis, and I'll bring them in there to a clinical setting where I can shoot exactly what radiograph and views I need to do.
I like that you take the extra step to go deeper to find out what's really going on there.
Yeah.
And just
It's
see what it is
essential
to
in
whether
some
or
of
not
these cases.
to, to just, oh, well, it's loose, let's pull?
If it's, I've had some that, especially in older horses, that the tooth is so loose that you can see it's just going to come out.
Right,
and those, I've got no problem with going ahead and working on those. If there's anything else funny going on, or I don't know, or if it's a younger horse that has potentially a much longer reserve crown in there, and I need to see what that crown looks like, I'm definitely going to shoot some radiographs ahead of time to see, because I've had some really weird shaped roots that have gone on that have either been helpful for me to know ahead of time that they're like that, or in some cases I'll look at that and I'll say, this is not something that I'm going to do. We're going to send you on to a surgeon to go ahead and take care of this situation, because there's some complicating factors there that I don't think is going to be a straightforward extraction.
Yeah, well, that's good to have that kind of behind the scenes.
Right. Good depth.
Yeah. Now, we have a horse coming in next month. It's a client of yours. I believe his name is Jag, with no teeth.
Okay. Yeah.
Rachel's horse.
Yes.
And I've never had a horse here with no teeth.
Jag is he's had a good life with his teeth.
But he's done. So does he still get floated?
We do. I don't do a lot of floating on him when I've seen him. She's kept up with a regular routine visits and looking in there, but for Jag especially, and I'm trying to remember what we've done on him. I think we've maybe occasionally removed a loose tooth or something like that. But he's gotten to the point where he's almost more of just a dental check every year. We're looking in there. We're looking for teeth that may have gotten loose since last time that might be a problem. Occasionally on some of these older horses, you might have a little bit of floating to do. It's usually not along the whole arcade like you would do normally on a horse that has active erupting teeth and is a little bit younger. But there are some older horses that particular teeth in their mouth can still get kind of sharp. And so we may I kind of call it hunt and peck. Or spot floating. We'll do a little spot floating on some of those. And then also, one of the big things is looking for periodontal disease. We're looking for the stability of the teeth. We're looking for periodontal pockets where food is getting caught in there that can be a problem for them. And in some cases, the tooth may be stable, but they might have a really bad pocket where food is getting up in there and it's getting stinky and nasty. And in some of those cases, we'll go ahead and pull the tooth because we know in the long run it's going to be better to not have that pocket that's constantly trapping food in there than it is to have that. Flossing would be awesome. If you figure out how to get a horse to do that.
Very young. Next time we have a baby on this farm, we're going to start flossing.
I've teased a few clients before with it, and some of them looked at me like, are you serious?
Yeah. I had a horse, my rescue horse, who had never been floated at 12 years old when we got him. So he had holes in his tongue and gashes in his cheeks. And it took a while to get him where he needed to be, but he had a gap. And so he had disease setting in. Well, she had me flush it with a large syringe and diluted Listerine and all sorts of stuff. I went to the dollar store and got, the sauce things that you can buy for like condiments and things like that. And just cut the tip a little bigger, mixed it up, and worked it in there.
The squeeze bottle is great.
Yeah, like a water pick.
Yeah, like a water pick.
That's awesome.
Yeah, it worked. Well, and Luke, my quarter horse, had what you were saying, almost orthodontic work needed, because he had kind of some gaps with some food getting stuck. He was another rescue. He was starved growing up, and so his teeth were kind of messed up. But in, 2 years now, maybe you've been treating him, it's gotten much better.
There's all sorts of orthodontic forces that are going on in these teeth, and one of the problems with the malocclusions we're talking about, especially with certain types of waves and things, is depending on where they're located, they can sometimes cause spreading of the teeth. And ideally, their cheek teeth should all be like right up against each other to the point where they're so tight that you couldn't get a piece of floss in.
Right.
And that's the normal configuration. But as they get older, there's often kind of a natural gapping that takes place. And part of that is because the tooth root itself is tapered. And as those roots get closer and closer to the surface, you've got a little bit of a taper there, and so you'll start, on some horses, to see some little gaps. And we call those geriatric diastemas. Those are just for the fancy word, but they're gaps. They're basically
that.
But the gaps, no gaps is better than gaps, but not all gaps are a problem. They're a problem if they start trapping food in there, putting pressure on the gingiva and the soft tissue, and causing periodontal disease. If you have a gap that is fairly wide and food just kind of sits in there, but it's not trapped, and it washes out very easily, like with a little water pick when I'm doing my exam, or if when they take a drink of water, it easily flushes out of there, and the gum tissue is nice and pink, that's not really a big concern.
Okay.
The ones to worry about are the ones where you get food that's trapped and it stays in there, and it's a little bit harder to get it to pick out. So in those cases, I've had owners like you that have flushed mouths out, or a lot of times just the hose is great. If the horse is good about just putting the hose in their mouth and let them play around with it. I mean, honestly, if they kind of slap their tongue around, they're swishing, and swishing is good because it'll kind of free up those little areas in there. Now, not all horses go for it. Some of them are like, no. So if you can flush those, however you do it, it's a good thing. I tend to prefer the hose just because it's a large volume of water, and like I said, they do kind of swish when you do it. But a squeeze bottle, a syringe if you have to, a pump-up sprayer, anything like those is helpful. Yeah, like a pump-up garden sprayer. I usually tell people try to find one that's got a sturdy wand, because the little plastic ones, one crunch and it's gone.
Oh, that's true.
And also use one you hadn't used other stuff in. Get a fresh one. But sometimes that'll work well. It's not a real strong strain, but if you just need to get a little water flushed up in there, that'll work as well. And then the incisors, if they have some problems with the incisors, some of the horses will get to the point where you can kind of hold their lip up and just kind of pull stuff out if they get it trapped in there. I've had some people that have gotten like the largest toothbrush that they can find and just kind of use that to kind of pull the little like grass fibers out of there, and it's better than get your fingernail in there.
Now, how
sometimes.
often would they do that?
Daily would be great, but it just depends on how bad it gets trapped in between those incisors and how much pressure, once again, is putting it on the gum. If it's just a little few sprigs of grass sticking out and it's not really causing gum disease, that's probably not a big deal. But if you got one, especially down along the gum line where it's getting in there, when you pull it out, especially if you see bleeding or anything like that, that'd be something it'd be nice to try to clear that up if you can. And hopefully you got a cooperative horse.
Hopefully, yeah.
Now, I thought it was interesting when you were working on Levi, his canine. It was like, you said it was almost like plaque, like you went in there and kind of took on it. Is that something that's typical, or
yes, it's very common.
Okay.
Those canine teeth are not chewing teeth, so they just kind of sit in there, and because they're by themselves, and they kind of sit, especially the lower canines down here, they kind of sit in an area where there's a trough of saliva in their mouth.
Okay.
We think, at least, that's why some of these will get some calculus formation, and it's like tartar or plaque or something like that. It forms up on the tooth. I've personally never really seen it cause an issue with the tooth itself as far as like decay or something, but it will build up and it will cause gum disease and periodontal disease because it'll put pressure on the gum. And I've seen gums that have been severely receded because of the pressure from this calculus that builds up. Now, in most cases, it's usually just a little bit, and I just kind of clean it up as part of the dental exam. But you'll get some horses, I've had it so big around the tooth, you can't even see the tooth. It's just a big gob of calculus. And you go in there and kind of clean that up. A lot of times it just kind of crumbles away. And lo and behold, there's a tooth underneath there.
Wow. Now, does it get on other teeth other than just the canines?
It's mainly the canines, but sometimes you'll see it along some incisors in some cases. Occasionally I'll see it on cheek teeth, but it's usually the canines. You'll see it build up.
But these are horses that you're not treating regularly.
No, it'll happen on a yearly basis.
Really?
Yeah.
Okay.
And they're all different degrees. I've got some that they barely get any calculus, and then I got others that it'll be caked on there pretty good, even with a yearly one. You get in there, and I've got some owners that know it's there, and they'll actually take it in there kind of with their fingernail from time to time, kind of just flick it off, basically. I've got some other soles that use a screwdriver or something, and I don't know I could recommend that. But if you can kind of scrape it off with your fingernail or something soft, like maybe a little plastic fork or something, or a knife or something that's kind of non-traumatic, at least to the dental surface. Nothing metal. You can get in there and kind of scrape it off, and a lot of times if you just get under the edge, you can chip it off of it.
Okay, I just thought it was interesting to see, because she hadn't had any of that issue, and then
some of them, I've got some that, and it doesn't really matter with the size, to me, the size of the canine either. It seems to be kind of an individual horse thing.
Kind of like people, though, because like I tend to build up a lot of plaque, and a friend of mine doesn't build up any at all. Like they hardly have to go to the dentist, so it's like, well, I have cavities, they don't, fillings, like that.
And it'll be variable even in the same barn, where they're basically on the same pastures and same food program and stuff. Some of them will have quite a bit of calculus, and others not much.
So that makes interesting. Yeah, we covered a lot. Like, it's so interesting. And every time you work on a horse, it's just something different. Like to learn on.
Well, anytime you think you know everything about something, you're not paying attention.
Absolutely, yeah. Well,
because there's a lot of people that are doing equine dentistry that are been very innovative, and I try as much as possible to mooch off of their knowledge because they come up with things that I thought, that makes a lot of sense, but you got to pay attention because some of the things they come up with 2 or 3 years later, they'll say, I don't do that anymore. Yeah. So you have to, it's a changing process, and you have to kind of figure out what's going to stick, as far as the information. There's a lot of good basic dentistry information as far as maintenance and taking care of the horses that we know. There's a lot of things that are emerging that we still don't know much about. Mm-hmm. One of the primary periodontal diseases in the incisors that we've seen, and I think we've had a few horses that have had some symptoms of it. It's got a real long name, but it's abbreviated EOTRH, and it's a progressive periodontal disease that we see primarily in incisors. It's one of those things that we're learning more about what's happening, but we still don't know. We know very little about why it happens to some horses, and there's still no effective cure for it. Typically what we have to end up doing is gauging how much of a problem it is for the horse as far as their comfort and whether or not there's like little abscesses and disease present. And in many cases the treatment is to go ahead and extract those teeth. Now the good news is most of those horses that do have teeth extracted are far more comfortable without those teeth in there than they are with them in there. And the disease process is it's a periodontal process, so if you take the tooth away, process goes away. Right. It's not something that just sticks around. If the teeth are not there, the disease goes away. Sure. So it seems like an extreme treatment, and very often is kind of the last step in a stage of treatment that we're doing. But it's very definitely indicated in some of these horses, and I've had some of them that I've done all 12 incisors on before, and it seems very drastic. And I've warned the owner ahead of time that this is going to look pretty dramatic for a while. But those horses, I've had some of them, the owners have called me even a day or two later and said they're eating like no tomorrow. Wow. Like they were in pain before. Sure. Yeah. Sure. And so a lot of these horses are very stoic, especially if they have things that creep up on them over the years. And sometimes I think they don't really know that they're dealing with it until you take away what is the problem, and then all of a sudden, oh wow, that's and then you get a change sometimes in attitude, certainly a change in behavior if they're eating a little bit more aggressively and all. But yeah, there's all sorts of things like that are kind of new and emerging and changing, and if you caught up on things 5 years ago, you may be behind the times already because things can rapidly change.
Yeah, we don't try to keep up. We just let you keep up, and we bring you here. We check the ponies once a year, and make sure everybody's good. Any more questions?
Not at this time, but next visit, I'm sure.
No, we're done harassing this man.
No.
Oh my gosh.
Oh, no.
Okay, we're never done harassing you.
No. The questions never stop.
Yeah, no, they don't. Well, and I know probably about 4 years ago, I had a new barn manager here, and you were kind enough to let us sit in, and she asked a ton of questions, and that's on our Leatherman Lane YouTube channel.
I've watched that.
Yeah, no, you've got a really good, nice video.
Thousands of people watching it, and I went, well, we should do something like that here. So this turned into way more than I thought it was going to, because we've recorded almost every horse that we've done out here. We've had wolf tooth extractions. We extracted Ronald's tooth when the vet came out. Parrot mouth, waves, slants, weird configuration in the head.
You're describing a textbook right now.
I mean, right?
That's everything that's in the textbook.
And they're all here at Leatherman Lane. Yeah, so it's been really cool to watch, and hopefully we can get some good video for the people who weren't here. And we'll just keep asking questions.
That's right. I love it. Thank you.
I love it. Well, thank you for letting us pick your brain and sharing with the folks. You guys be sure to check out Dr. Taylor if you're local and need a great dentist. Like, share, subscribe, comment, ask questions. I'm sure you're subscribed. If you're not, you probably should be. But
I think I am.
You can answer the questions if people have questions.
That's right. That's right.
Yeah, because I don't know anything.
Yeah, we'll just forward them.
I talked to this guy.
That's right.
Well, my email address is on the website. So as I said, all the pictures and stuff on the website are very old, so you can catch up on my memory lane if you want to.
I love it. Oh, you want
to. The email address is on there. This is the phone number, so if people have individual questions or would like to contact me, they can do that.
That's perfect. Awesome. Well, thank you.
You're
going to take these horses back to their pastures and we'll let them out. Now that
sounds like they're all ready.
They're all away. Perfect. Awesome. All right. Bye, guys.
Bye, guys.